Question number 1. Drug which is contraindicated in head injury, and the options are oxygen, IV fluids, morphine and antibiotics. And the answer is option C, morphine. Large antigen antibody reaction is required to cause, and the options are serum sickness, Arthus reaction, uric acid and anaphylactic reaction, and the answer is option B, Arthus reaction. What is meant by Arthus reaction? Arthus reaction refers to an acute localized inflammatory response that typically occurs after vaccination. So it's called as Arthus reaction. Lifelong immunity is seen in all of the following except, and the options are pertussis, mumps, rubella and plague, and the correct answer is option D, plague. Virus causing chickenpox belongs to, and the options are pox virus, herpes virus, Coxsackie virus and adenovirus, and the answer is option B, herpes virus. Candidiasis is frequently associated with all except, and the options are OCP user, IUCD user, diabetes and pregnancy, and the answer is option B, IUCD user. Quarantine period for yellow fever is, and the options are 4 days, 6 days, 8 days and 10 days, and the answer is option B, 6 days. Secretory piece of IgA is synthesized in, and the options are T cell, B cells, lymph node and mucosal epithelium, and the answer is option D, mucosal epithelium. Single skin lesion is seen in which type of leprosy, and the options are LL, TT, BL and BT, and the answer is option B, TT. Let's see all. LL means lapromatous leprosy, it affecting the nerves, skin and organs. TT, it means tuberculoid leprosy. It is single skin lesion distributed on face, trunk and extremities. BL means borderline lapromatous leprosy. It is widespread bilaterally symmetrical lesion. And BT means borderline tuberculoid leprosy. It is somehow similar to TT, means tuberculoid leprosy. So the single skin lesion is seen in TT, tuberculoid leprosy, which is not useful method of diagnosis of herpes infection, and the options are DNA analysis, serology, tissue culture and microscopy, and the answer is option A, DNA analysis. Which of the following is the most severely affected in Kala Azar? Options are spleen, liver, adrenal gland and bone marrow, and the answer is option A, spleen. Mature defense mechanism are, and the options are sublimation, alteration, anticipation and all of the above, and the answer is option D, all of the above. Tourette's disorder best treatment is, options are chlorpromazine, imipramine, haloperidol and lithium, and the answer is option C, haloperidol. Let's see Tourette's disorder. It is nervous system disorder involving repetitive movements or unwanted sounds. Which antibiotic is contraindicated in botulism? And the options are ampicillin, gentamicin, cephalosporin and penicillin, and the answer is option B, gentamicin. All preterm babies and those with the birth asphyxia should have which neuroimaging? And the options are ultrasound, CT scan, NMR and none of these, and the answer is option A, ultrasound. Exogenous surfactant is given via, and the options are inhalation, endotracheal tube, IV, intravenous and orally, and the answer is option B, endotracheal tube. Active immunoprophylaxis after exposure is recommended in, and the options are rabies, hepatitis, tetanus and all of the above, and the answer is option D, all of the above. Meningococcal vaccine protects against which strain of organism? And the options are C, Y, A, and all of the above. And the answer is option A, C strain. Nephrotic syndrome is a complication of, and the options are Plasmodium vivax, Plasmodium falciparum, Plasmodium malari, and Plasmodium ovale. And the answer is option C, Plasmodium malari. All of the following are live attenuated virus vaccine except, and the options are OPV, measles, rabies, and mumps. And the answer is option C, rabies. In India, Kala Azar is most frequent in, and the options are Andaman, Bihar, West UP, Uttar Pradesh, and East Rajasthan. And the answer is option B, Bihar.